Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio today Professor Felicia Anumah. You're welcome.
Thank you.
Felicia Anumah is the Dean of the Faculty of Health Sciences, of the Faculty of Clinical Sciences, University of Abuja. She is a professor of endocrinology and diabetology. I just heard that in this COVID-19, people who have diabetes and high blood pressure are more predisposed than many others, people who are among the pre-existing conditions. So I would like us to discuss the whole issue of people who are more predisposed. We are told the elderly who have pre-existing conditions, and we have kept hearing things like diabetes and high blood pressure. What's going on?
Thank you very much. I always say that God is a perfect scientist. There's a way he has arranged the body, the human body, whereby one of the things he did is to put in us a system or an apparatus that can help us handle any invader coming in. Now, and that is what we call the immune system of the body. You know, they are like soldiers. When any strange thing comes into our body, the soldiers, they quickly bring out the soldiers to help fight it, and then it finishes. Actually, when we come across any bacteria or virus, the body's defense mechanism tries initially to handle it. And in many instances, actually, they succeed. The body succeeds in handling it.
And some of them we don't get to even know.
We don't get to know at all. In fact, many times we don't get to know. It is when the bacteria or the virus now, the effect, overwhelms the body's innate mechanism, defense mechanism to handle it, that we come down with some symptom that will make us know that, okay, we have a problem. So diabetes, for example, I usually define it simply as a condition where the body is unable to utilize glucose properly.
A condition where the body is unable to properly utilize glucose.
Utilize glucose or anything we eat, actually. Because in the pancreas, an organ, a gland inside our abdomen, we have the pancreas there, we have the cells that produce insulin there. And insulin is the famous chemical that helps us to utilize everything we take as a source of nutrition and energy. So when we don't have sufficient insulin, then everything we eat, we are not able to utilize it as a source of nutrition and energy, so it remains in the blood. So everything builds up in the blood sugar rises, and then we call that diabetes. Now, diabetes, when we have excess sugar in the blood, it has a way of affecting the immune cells. Mm-hmm. Sugar coats everywhere you have protein in the body. Sugar coats it, glucose coats it.
So everywhere there is protein in the body?
Everywhere there is protein in. That is why the complications of diabetes are so devastating. They are everywhere. Because this sugar, excess sugar, coats the membrane of every immune cell.
I had studied about fatty liver, yes, which is also part of the coating you are talking about.
Yes, so sugar coats the cell. The cell is no longer able to engulf bacteria and digest it and kill it. That's the reason why people with diabetes are more susceptible to infections of any sort than any other person.
Not just virus.
No, not just
virus. Even
virus.
Bacteria.
Even bacteria. Because the membrane is coated with glucose, it can no longer function as normal, as it will do normally. So there is problem with the immune system now. There is problem with us handling anything that comes in. So that's why diabetes patients are more predisposed to infections. And then, for example, COVID-19, they can't handle it. The cells are unable to handle it.
So what pre-existing conditions like diabetes, what they do is to weaken the immune system.
Weaken the immune system.
And so the immune system cannot fight the virus.
Cannot fight it. So the symptoms become more overwhelming in them to the extent that some of them can even die.
What about high blood pressure, hypertension?
Well, hypertension, you see, when you have hypertension, especially for a long time, it also affects the body's, it affects various organs in the body. And therefore, the capacity for the body to cope with any other challenge that comes is also weakened.
Okay. So the high blood pressure itself is a challenge.
It's a challenge.
Which the body is struggling to cope with.
Which the body is struggling to
cope with. So when COVID-19 comes, it may just give up.
Yes.
So I did hear from you that a lot of those who have died, you know, people have died in this country from COVID-19 and elsewhere, but that a lot of those who have died are not people that you can say had averagely good health, that many of them are people who were already struggling with one illness or the other.
Yeah.
So what it means is that COVID-19 can be described as an opportunistic illness.
Yes, particularly in those people who already have one condition or the other, diabetes, hypertension, heart disease, kidney disease, cancer. These conditions depreciate the body, so to say. Depreciates, reduces the capacity of the body to cope with any other thing. So when COVID-19 now comes in, is a problem. For example, cancer. The cells to fight the infections are not even there. So it's very easy for a cancer patient to succumb to this. Also, very importantly in our environment is the issue of nutrition.
Nutrition.
You know, we need proper nutrition. We need remember, it's very important for us also to know that a balanced diet is not equivalent to a healthy diet.
Wait, balanced diet
a balanced diet is not the same as a healthy diet.
What makes it balanced if it is not healthy?
You know, when you say balanced diet, okay, it has all the 6 components, you know, of diet: protein, carbohydrate, fat, water, salt, and minerals, vitamins, and so on. But you know, the proportions now determines what is healthful and what is not
Okay,
healthful.
And you do not know those proportions simply by what you put in your plate?
Yes. So the proportion of what you take determines, for example, fat should be in our normal diet.
Yes.
But how much fat? And what type of fat is important? That's what differentiates it now from, is it helpful diet you are taking or just harmful, a balanced diet you are taking. So diet is also very important. Nutrition is very important in, you know, the issue of having disease or having infections and so on. If our nutrition is not healthful, is not, you know, containing all that it should contain to enable us build proper immunity, to enable these cells, you know, to build proper immunity, then we will also have a problem.
Long before this COVID-19, for the past 5, 6, 7 years in your life, you have been engaged in advocacy against diabetes. I mean, you call diabetes the ticking time bomb or something.
Yes, it's a time bomb.
It's a time bomb.
Waiting to explode.
Waiting to explode. Diabetes is supposed to be almost like a global epidemic because of the millions of people that have either pre-diabetes or have been diagnosed with diabetes. Now, and I know the advocacy you have carried out, including with secondary schools. You have been working with World Diabetic Federation. How much progress have we made in terms of awareness, diabetes awareness, and change of lifestyle, change of eating habits to reduce the chances of people going down with diabetes?
Yes, I think some progress has been made, and of course we'll continue to work, you know, to make further progress. I've been working a lot with the Federal Ministry of Health and with the World Health Organization, and there are quite a number of programs that we have been doing, educating people, the public, educating even the healthcare providers themselves and children as well. I mean, one of the success stories I have with the secondary school project on diabetes prevention, working with 3,000 secondary school children for 2 years, is the fact that some of them were now able to get the message, and during break time, it's no longer a bottle of fizzy drink and donut, but a bottle of water and an apple.
And an apple and a
or
fruit, yes.
When the school is a day school, the parents, prepare something healthy to give the child to go to school with. Because what we found out during that program is, even when the school is a day school, the child is easier for parents to give cash money to the child. When you get to school, buy a bottle of drink and donut. But we've been able to change that orientation to some extent. But I know a lot of work still needs to be done. In that program, we had a 30 minutes playlet that we showed parents on PTA meeting days. Because we discovered that the average Nigerian, what is in the brain of the person is that when they have a fat child, for example, it's like I am affluent and my child is showcasing
my child is
affluence.
Evidence of my
yes,
affluence.
It's showcase. And Nigerians, we are people who like to show off. We like to show things. So that's what, and we need to wash that out of the brain of Nigerian parents to make them realize that for every height, that's the way God has recommended. There is an ideal weight for every height. That's the way God has created us. And once we allow that weight to get beyond what the height is meant to carry for that particular person, then we are inviting problems.
So viewers, we are hearing, there is an ideal weight for every height. And then you have some BMI.
Yes, so we have a way of assessing, what, how much weight this individual is accumulating in the body. For example, the body mass index, which is very simple to calculate the weight of the person in kilograms divide by the height in square of the height in meters. So if, for example, weight is 70 kg, that's 70 kg, and height is, say, 1.6 meters. So it is 70 kg divided by 1.6 meters squared, or 1.6 meters times 2. That gives the BMI, the body mass index. And normal BMI, irrespective of the age of the person and the sex of the person, is 18.5 to 24.9. So any BMI 25 and above is not correct. It means some work has to be done. And then we also measure what we call the waist circumference. You take the tailor's tip and put it round your navel and measure. We have normal for females, we have normal for males. For females, it should not be more than 35 inches. Females. No matter how many children we have, how many pregnancies we have had, if it is more than 35 inches, it means that we have accumulated fat here and we need to get rid of it. For males, it should not be more than 40 inches.
Hey, my own is 38. So I'm still within.
You're still within. You're lucky. You're still within.
Yeah, I mean, the last time I put tape by my navel, it was 38.
Okay, beautiful.
Okay.
So it should not be more than 40 inches for males. If it is more than that, you have accumulated fat here. The problem is that the fat in the abdomen is the most dangerous fat.
It's the worst form of fat.
Actually, fat here is an evidence that that individual is on the way to diabetes, is on the way to hypertension, is on the way to heart disease and all the consequences.
And he's making himself or herself liable to something like COVID-19.
Yes. And he's making himself liable to any other infection, including COVID-19.
We still have, thank God for the project you had with WDF, World Diabetic Federation, on this secondary school one you talked about. But we still have many secondary schools, because I do visit secondary schools, who a lot of breaks, especially our elite secondary schools. They have 2-3 tea breaks in the day, and meat pie, donuts, all these things that are not healthy are still what they give people. I think there still needs to be a lot of work, and I hope that a number of your colleagues can also be part of this work to educate people. Go to the motor park and see what people take when they are hungry. They take a loaf of bread and a bottle of.
Yes.
for me, it's almost like taking poison
Yes.
instead of food. Whereas in that same motor park, there are bananas, there are oranges, there are apples, but the person will take the money and buy a bottle of and a loaf of bread. How many people, these things that are all over the internet, how many people know, for example, the number of cubes of sugar in a bottle of, you know, you wrote a book to deal with all that, but can you tell us about
the can of Coke, the can contains
okay.
equivalent of 7 cubes of sugar.
7.
Yes. Then the bottle, the small bottle, contains equivalent of about 15.
15.
While the one they call Auf size in Nigeria, the very big one, almost 27, 30 cubes of sugar.
In one bottle of?
Yes, yes. So the equivalent of that's what is an equivalence. Now, the problem is, I'm sorry to say that knowledge is not so valued in Nigeria. For example, I mean, I have been in this thing for a long time, so I have my impression. A disease that a Nigerian is at risk of, the Nigerian is not ready to listen to what you have to tell him or her
maybe
prevent
some
to prevent him or her having the disease. He will rather wait, have it, and deal with the consequences. Nigerians wait. When I was having that, when I was doing that project, I had a lot of difficulties. Nigerians will tell you, when I was younger, I didn't have the privilege of all this. Now that I have the money to afford all this,
will enjoy
please
it.
don't tell me there is anything wrong with it. I need to enjoy my life. Nigerians will say, I beg, it is something that will kill somebody one day. Let me enjoy my life. So there is a need for Nigerians to have the desire to want to know.
The desire to know.
Yes, the desire to want to know, so that they can get empowered. I mean,
knowledge is power.
These non-communicable diseases or lifestyle diseases, they are preventable. Science, all manner of researches have been done to show that prevention of lifestyle diseases has been proven. It is powerful and it is possible. That's the truth. So they are preventable. When I see people come to us in the hospital with all the devastating complications of diabetes, I feel so sad because I know this is preventable.
Could have been prevented.
Yes. Recently I had a 39-year-old female with 3 children who had to have bilateral amputation in the teaching hospital.
The 2 legs removed.
She came with gangrene of the 2 legs, and the only way to save her life now is to remove the 2 legs. What a pathetic story. But the truth is, if she was empowered and was knowledgeable enough to prevent diabetes, she won't even get there.
And the truth is that today, that knowledge is available everywhere. I mean, unlike before, I mean, see how much I am able to just going through social media, how much I am able to study about diabetes, about all these non-communicable diseases, about what number of cubes of sugar is in one bottle of, and so on and so forth. And there's so much discussion that goes everywhere. You don't need to go to medical school now to know these basic things. But like you said, if there is no hunger to know. And also the impression that to overindulge ourselves is equivalent to enjoyment.
Yes, yes.
I mean, when we indulge ourselves, when we overdo anything, it definitely becomes punishment. It's no longer enjoyment. Yeah. The person who is taking 2-3 bottles of a day is destroying himself.
I am even told that there are people who still add a few cubes of sugar to the Coke.
That is not sweet enough.
Before they drink it. Yes. There are people who add cubes of sugar to the bottle.
But you see, the strange thing is that I think 95% of people will not take 20 cubes of sugar and put in their mouth to take.
No.
They will consider that horrible.
Yes.
But they will drink a bottle that may be containing 15, 20 cubes of sugar. And we pray that that people will see reasons. Now, before we end this segment of our discussion, what other predisposing health conditions for that can amount to weakening of immune system? We have discussed diabetes. We have discussed high blood pressure.
Sickle cell disease, for
Sickle
example,
cell, okay.
that is common in Nigeria, can also weaken. In fact, we had a patient with sickle cell disease and COVID, but to the glory of God,
Yes,
she got better and she was
Praise the Lord.
discharged. But that can also weaken any disease whatsoever. Any disease whatsoever weakens the body. And once you are weakened, any other stranger coming in now, you can't handle it.
Particularly, they say upper respiratory tract
Yes,
infections.
because the virus attacks the upper respiratory tract. So if there is an underlying respiratory disease, for example, asthma, tuberculosis, chronic obstructive airway disease, or even cancer of the lungs, anything that is affecting the upper respiratory and the lower respiratory airway, that's the lungs, already has predisposed the whole of that system, the respiratory system, to overwhelming impact of COVID-19.
Has anyone studied, for example, COVID-19, the virus, how long it takes before it starts descending to the lungs, for example? How long it could remain in the upper part?
These 2 weeks that we give for anybody, once it gets there, within initially, of course, the person may have some, some catarrh, not everybody anyway, and then some little pain in the throat. So gradually it descends down, so that by that 2 weeks, it would have gotten there and the person can start manifesting the symptoms of, cough and so on.
One of the symptoms that has been added by World Health Organization is loss of taste and smell.
Yes.
Now, loss of taste and smell, and they are saying that actually that may be among the first indications.
Yes, that is upper respiratory. That's upper respiratory. The taste is with our tongue,
yes.
And smell is with our nose. So it is upper, and that's where it gets to first. So that can actually be, one of the very first indications that there is trouble, when you lose taste or you are not able to smell
so
things.
For our viewers and for all Nigerians, I think this is very important that the World Health Organization has added among the symptoms, the earliest symptoms for somebody who may be down with COVID-19 virus, that all your life you know the taste of salt and honey, and you can distinguish between honey and sugar, and you can distinguish between pepper and ginger and so on. All of a sudden, you can no longer distinguish. Then the smell, normally you can smell so many things around you. All of a sudden, everything is flat. Immediately, you should know that these are danger signals. These are red flags that something may be wrong. And I think that is a good, if that is true for everybody, meaning if most people who suddenly lose taste
of smell and taste,
then that can go a long way in helping the self-diagnosis before the person goes to the hospital. Now, the good news that you have been giving me all this while is that most of the people who are coming down in your hospital are recovering, including those with pre-existing conditions are recovering. So we need to thank God that whatever strain of coronavirus in our society, it is not the type that is killing everybody. That many people who go down with it are recovering. You just told me of a colleague in one of the teaching hospitals who was down with it last week, but who is recovering.
Yes, he's one of our professors of infectious disease. He was down 2 weeks ago with fever, with muscle aches, sore throat, most of the symptoms. But to the glory of God, he has recovered. Remarkably, he's even doing exercises around now. He's able to eat well, and the fever has stopped. For almost a week now, he has become fever-free.
On that positive note, we will end this segment of our discussion that COVID-19 is not a death sentence. That people do recover, and people are recovering in large number, young and old. And we are grateful to our health workers. Professor Felicia Anumah is my sister, and she is among the health workers. She is Dean of the Faculty of Clinical Sciences at the University of Abuja, and they are working very hard. Your daughter is also a doctor and working hard on this. We pray for all the doctors. Luke's Terra and Islamic Education Trust jointly issued a thank you note to all health workers that God will protect you all and protect your families. It is in my interest to pray for you. It's in my interest to pray for all health workers. May the Lord protect you all. Amen. Amen. Thank you.